Hello, my name is Joel Holloway, and I have been CPR certified for 6 years. And today, I will be giving you the step-by-step information needed to possibly save a life. The American Heart Association says that 70% of Americans may feel helpless to act during a cardiac-related emergency, either because they do not know how to administer CPR or their training has been significantly lapsed. This staggering statistic shows that many Americans are ill-prepared to deal with a cardiac-related emergency. However, CPR can be simplified if broken up into two phases. Phase 1 is the steps needed to take before performing CPR, and phase 2 is performing CPR. So let's begin with phase 1. The first thing you're going to do when walking onto a scene is make sure that the scene is safe for both you and the person needing assistance. For example, if you're walking on and you find somebody unconscious laying in the road, move them to the side of the road before beginning the rest of the steps. You never want to put your own life in danger trying to save someone else's. The second step is to ask if they are in need of danger. If you walk on somebody laying on the floor, tap them on the shoulder, ask them if they are okay. Sir, do you need help? Ma'am, are you okay? Are you okay? Once confirming that they are in need of help, you can move on to the next step, which is call 911. If you are by yourself, stay with the victim and call 911 using your phone, or if there's a bystander, point to one and make them use their phone and call 911. Make sure that you point to someone and say, you do this. It makes them feel empowered and gives them a notice that you have to do it. Because most people will feel scared, and it helps you take the lead in the situation, being like, hey, you need to call 911. The next thing to do is to lay the victim on their back, tilt their head slightly up, chin to the sky, and listen for breathing for 10 seconds. If there is no breathing, then begin CPR. Now that phase 1 has been completed, you are ready to begin phase 2, which is performing CPR. Now, with one hand on top of the other in the middle of the chest, you're going to perform compressions using your body weight hard and fast. Going at a rate of about 100 beats per minute, you're going to push in about 2 inches deep. The best way to help stay on pace for 100 beats per minute is to use songs and sing along to them. For example, Dancing Queen by ABBA or Staying Alive by the Bee Gees are at 100 beats per minute. Also, you can use Sweet Home Alabama by Leonard Skinner. Once completing about 30 compressions at 100 beats per minute rate, you're going to move on to the second step, which is rescue breaths. So now, pinching the victim's nose and tilting their head slightly back, you're going to form a complete seal with your mouth against their mouth. Now, breathing into their mouth and raising their chest, you're going to perform 2 rescue breaths, then continue back with 30 compressions. You're going to use this ratio of 30 compressions and 2 rescue breaths until either one of these things happen. Either the scene becomes unsafe or higher personnel come to take over. For example, a doctor shows up or an EMT, then they can take over. That is how you properly perform CPR. The CDC says that 600,000 Americans die each year from cardiac-related problems, but the chances of survival are significantly increased when CPR is performed. I hope you learned a skill necessary to save someone's life, but I hope you never have to use it.